Hi, I am Dr. Nikhil Agrawal. I am Director of GI Oncosurgery at Max Super Speciality Hospital, Saket in New Delhi. While the number of colon cancer cases are decreasing in the Western world, we in India are seeing a progressive rise. Today, let's understand the treatment options for colon cancer. Treatment and outcome of any cancer, including colon cancer, depend on the stage in which we detect it. Treatment of localized colon cancer is surgery. Surgery for colon cancer is called colectomy. We call it by various names such as partial colectomy, right hemicolectomy, left hemicolectomy, transverse colectomy, or anterior resection, depending on the part of the colon which we are removing. In this surgery, we remove the part of the affected colon, the colon which is affected with cancer, along with all the adjacent lymph nodes. We then join back the intestinal ends to restore your intestinal continuity. Earlier, we used to do this surgery with an open technique. Now, all these surgeries are being done with robotic or laparoscopic techniques. We call them minimally invasive techniques. In this, we make small holes in your abdomen instead of a long incision which we used to do in open surgery. This gives you faster recovery with reduced pain while you are recovering from the surgery. Sometimes we also have to remove the whole colon. It is done when the whole colon is diseased. This happens in conditions such as inflammatory bowel disease, polypoidal disease of colon, and some more diseases. Sometimes colon cancer will present in a state where it has completely blocked the intestine. This condition is called intestinal obstruction. This requires emergency surgery, and when we are doing this emergency surgery, we will not be able to join back the intestine because they are unhealthy and swollen. So we have to bring out one end on your abdomen as stoma. These days, we may place a stent to relieve the obstruction and then do a planned surgery a few weeks later. Some patients present with advanced colon cancer where the cancer has spread to other parts of the body such as liver, lung, and peritoneum. If this spread is limited to a few spots in our body, we can still plan a curative treatment. In this, we do surgery for colon as well as for the spots which may be liver resection, lung resection, or cytoreductive surgery with or without HIPEC. We also sometimes use a technology like radiofrequency ablation, RFA, microwave ablation, or radiation to burn the spots in the liver. Once we have operated a patient for colon cancer and the biopsy report shows that the colon cancer is limited to the inner walls of the colon, no further treatment is required. However, many of our patients will also need chemotherapy, targeted therapy, and immunotherapy before and after surgery depending on the spread. Some patients present with very advanced stage of the disease where the tumor has spread to many spots in the body. These patients are treated with chemotherapy, targeted therapy, and immunotherapy. Early detection and appropriate treatment save lives. Stay alert, stay healthy.